Okay, good afternoon, folks. I have discussion A for you this afternoon. We're discussing Alzheimer's treatment has two goals: slow disease progression, in eligible people with new anti-amyloid drugs, and manage symptoms and behaviors with established medications and non-drug approaches. Here we go with today's presentation, guys. Please join me. Hope everybody enjoys. Okay, Alzheimer's treatment has two goals: slow disease progression in eligible people with new anti-amyloid drugs, and manage symptoms and behaviors with established medications and non-drug approaches. Treatment choice depends on stage, biomarker, confirmation, and weighing benefits versus risks, such as ARIA and antipsychotic harms. National Institute on Aging Alzheimer's Association overview of treatment categories. Okay. Disease modifying anti-amyloid therapies. What do they do? Target beta amyloid to slow cognitive and functional decline in people with early Alzheimer's or mild cognitive impairment due to Alzheimer's. They are not cures, but may modestly slow progression. Alzheimer's Association, National Institute on Aging. Requirements and monitoring: amyloid confirmation, PET scan, or cerebral spinal fluid test. Is required before starting. Regular MRI monitoring is used to detect ARIA amyloid related imaging, abnormalities in the brain, swelling or small bleeds, APOE4 status is often considered because it increases ARIA risk. Alzheimer's Association, National Institute on Aging. Symptom management drugs. Cholinase inhibitors, donepezil, Revelastin, galutamates are used for mild to moderate Alzheimer's to help memory and thinking for time. They do not change the underlying disease. Okay. Meantime, is used for moderate to severe stages and may be combined with a cholesterase inhibitor. National Institute on Aging. Medications for behavior and sleep. Non-drug strategies. Environmental changes. Routines. Caregiver approaches are recommended first for agitation, insomnia, and anxiety if drugs are needed. Some antipsychotics or other agents may be used cautiously. Antipsychotics carry a boxed warning for increased mobility or mortality in dementia-related psychosis and raise stroke risk. Key risks and trade-offs to discuss with your clinician. ARIA can be asymptomatic or cause headaches, confusion, vision changes, seizures, requires MRI. Surveillance. Medication side effects. Cholesterase inhibitors can cause nausea, diarrhea, dizziness. Meantime, memantine can cause dizziness or confusion. Antipsychotics increase risk of serious adverse events in older adults with dementia. National Institute on Aging, Alzheimer's Association. Practical steps and questions to ask. Ask whether amyloid testing is appropriate and whether you meet criteria for anti-amyloid drugs. Alzheimer's Association. Clarify monitoring plan. MRI scheduled. Infusion. Logistics. APOE testing. Expected magnitude of benefit and insurance, Medicare coverage. Alzheimer's Association. Prioritize non-drug behavioral strategies before antipsychotics. Ask about caregiver supports and community resources. Treatment is individualized for people with early stages with biomarkers confirmed. Alzheimer's anti-amyloid therapies may be an option but require careful monitoring. For most others, cholesterase inhibitors, memantine, and non-drug behavior care remain the mainstays to preserve function and quality of life. National Institute on Aging, Alzheimer's Association. Okay, bold summary, guys. Medicare will cover FDA approved Alzheimer's monoclonal antibody drugs only after traditional full FDA approval and when clinicians submit patients data to National Registry. This change restores a broader access compared with the 2022 draft restriction, but requires participation, monitoring, and documentation for people on Medicare. If you or a loved one in Pennsylvania uses Medicare, expect eligibility checks, registry enrollment, and coordination with your clinician and infusion center. Alzheimer's Association, Centers for Medicare and Medicaid Services. What the policy change actually says in plain English or plain language. Okay. Original 2022 draft. CMS initially proposed limiting Medicare coverage of new anti-amyloid drugs to patients enrolled in approved clinical trials. Only Alzheimer's Association trials only. Updated policy. CMS now will cover FDA approved monoclonal antibodies, Alzheimer's treatments that receive traditional full approval, provided clinicians participate in nationwide registry and submit real-world data about outcomes and safety. Centers for Medicare and Medicaid Services, Alzheimer's Association. Why this matters. Coverage is no longer restricted to clinical trials. Participants, so more Medicare beneficiaries can access these drugs, but access is conditional on clinician participation and data reporting. Key practical implications for people living with Alzheimer's. Eligibility and testing. To be considered for anti-amyloid drug, you'll likely need biomarker confirmation of Alzheimer's amyloid PET scan or CSF and clinical evaluation consistent with the drug approval indication. Centers for Medicare and Medicaid Services provider responsibilities. If you are your testing clinician and infusion sites must enroll in the CMS facilitated registry and submit required data about diagnosis, treatment, and outcomes. Medicare payment depends on that participation. Centers for Medicaid Medicare Services. Monitoring and safety registry data will help track real-world safety signals, e.g. ARIA, brain swelling, bleeds, and effectiveness across diverse patients' impacts. Expect MRI monitoring and other safety protocols per drug labeling. Trade-offs, limitations, and what to ask your care team. Trade-offs, broader access versus administrative requirements. Coverage is available, but only when clinicians comply with registry rules. Not all providers or infusion centers may participate. Limitations. Coverage applies only to drugs with traditional FDA approvals without confirmatory data. Centers for Medicare and Medicaid Services. Questions to ask your clinician or Medicare plan. Is this drug FDA approved traditionally for my condition? Will you enroll my case in the CMS registry, and who will handle data submission? Centers for Medicare Medicaid Services. What monitoring MRI schedule, APOE testing, and infusion logistics are required? And what are out-of-pocket costs? CMS's updated policy opens Medicare coverage for traditionally approved anti-amyloid Alzheimer's drugs, but ties access to clinician participation in a national registry and safety monitoring requirements. Patients should confirm eligibility, provider participation, and practical logistics before pursuing treatment. All right, guys, that's A for you. Gonna take a little break and see if I can do a B for you. I will see you guys for that in a little bit. For now, Gator Wellness. Take care, folks.